Bismillahirrahmanirrahim. Assalamu alaikum. So this is the last statement question. So I will highlight the important points here. So this is a 67-year-old man. He came to the emergency department due to abdominal discomfort and distension. 5 days ago, he had large volume watery diarrhea. 5 days ago, he had large volume watery stool 6 to 8 times daily after eating a meal in a restaurant. He also had mild abdominal cramps and nausea. His system resolved with oral hydration, but yesterday his bowel movement stopped abruptly and diffuse abdominal discomfort and distension worsened. His medical condition include hypertension, coronary artery disease, and heart failure, which is treated with diuretics. On physical examination, the abdomen is distended, tympanic, and mildly tender to palpation. On CT scan, which show that there is a diffuse colonic dilation with non-dilated small bowel. So based on these hint and the CT scan showing here that here is a diffuse dilation of the large bowel. Based on these hint, his recent watery diarrhea and his recent use of diuretic, the diagnosis of this question is acute colonic pseudo obstruction, which is also called Oglivie syndrome. So in this question, they are asking about that which of the following is the most likely contributor to this patient's current condition. So here the correct option is choice C, electrolyte abnormalities. Because of his recent watery diarrhea and the use of diuretic, here the correct option is electrolyte abnormalities. For the electrolyte abnormalities include hypokalemia and hypomagnesemia. So this patient presentation with abdominal distension, pain, vomiting, constipation, and colonic dilation on CT scan is consistent with acute colonic pseudo obstruction, which is also called Oglivie syndrome. His diuretic use and recent diarrhea likely cause an electrolyte imbalance, for example, hypokalemia, hypomagnesemia, which can precipitate Oglivie syndrome, and factors that lead to autonomic disruption of the colon, for example, major surgery, neurologic disease, anticholinergic medication. Treatment involved bowel rest, colonic decompression by the use of NG tube, and sometimes if the symptom does not resolve, we can add it by intravenous neostigmine. Come to the incorrect one. Choice A, colonic endoluminal mass. So patient having colonic endoluminal mass, first of all, the patient will have the symptom of the mass, for example, weight loss, fever. On CT scan there will be a mass on colon. Choice B, colonic hypoperfusion. So colonic hypoperfusion lead to ischemic colitis, which is usually present with hematochezia and abdominal pain out of proportion, and colonic dilatation is not typical. Choice D and E, entamoeba histolytica and inflammatory bowel disease. So entamoeba histolytica infection, which will lead to liver abscesses, and inflammatory bowel disease, for example, ulcerative colitis, will cause hematochezia, abdominal pain, and weight loss. Both entamoeba histolytica and ulcerative colitis can precipitate toxic megacolon, not diffuse dilation of the large bowel. Thank you.